Hello. There are a lot of myths and concerns about the vaccination against COVID-19. That is why we summoned some of the leading experts in the field and asked them to try to explain and answer to some of your concerns. In the next minutes, you're going to hear them answering your concerns, and we hope you will be convinced and get vaccinated.
There is no single measure against infectious diseases which is as effective as vaccinations. This is also true for COVID-19. You protect yourself by this vaccination, and you protect your family members and fellow citizens. Nothing is as effective as vaccination and is the only measure that can get us out of the pandemic.
We should consider that football is a team sport and many actors take part of the show, including players, referees, technical and medical staff, officials, press agents, and so on. Close interaction among members of the team is almost inevitable, as they all live together, often in closed spaces, not only for strictly sports-related activities such as dressing room, medical rooms, meeting rooms, but also in other places, such as bars, restaurants, and leisure dedicated spaces. Not to mention buses and trains and airplanes used for traveling, where circulating air is even more limited and possible virus concentration even higher. In 2021 European Championship, all the Italian team was vaccinated and successfully competed along the entire month of the competition, safely traveling and lodging across Europe in several countries with no further travel.
Now, with the pandemic, the travel in the world is now more complicated than ever due to restrictions imposed by authorities and rules that differ in many countries. And the reason for this regulation is to reduce the spread of the virus and to decrease the risk of severe disease, hospitalization, and death. PCR tests, antigen tests, and quarantine are examples of countermeasures that are imposed in order to travel. So in order to reduce the risk of getting the disease and spreading the virus, and in order to travel easier, get vaccinated now.
When we talk about side effects after vaccination, we have to compare the side effects after vaccination with the complication after COVID, since all unvaccinated persons become infected with the virus. So let's start with the so-called long-term side effects. Side effects occur within a few days or weeks after vaccination because the immune response triggered by vaccinations requires this time. Therefore, long-term side effects that occur many months or years after vaccination are not plausible. Here you see a study comparing complications after COVID with side effects after vaccination in more than 2 million people vaccinated with an mRNA vaccine in Israel. And you see here in the graph that almost all observed complications after COVID were much more frequent than side effects after vaccination. Only for shingles and lymph node swelling, the risk was higher after vaccination. However, the absolute risk was quite moderate, with less than 20 persons per 100,000 in the case of shingles. For all other side effects, the benefit of vaccination compared with infection was quite clear.
So everything about COVID is about putting the things in the right perspective. I'm not going to lie to you. Side effects of vaccination do occur. They occur in about 20% of people, but the vast majority of these are very mild flu-like symptoms that last a couple of hours or days. In only 0.14% of people, side effects are serious. And occasional death is so extremely rare that it ends up on every front pages. As opposed to that, in COVID-19, there is something called long COVID. It's not the disease, it's a number of diseases put together, a number of symptoms, a number of signs. like headaches, loss of hair, loss of concentration, neurological deficit, and even harder things. They happen in about 10% of cases. And finally, mortality of COVID-19 moves somewhere between 1.7% and 3% of all of the cases. So when you do the math, everything is on the side of vaccination.
Myocarditis is inflammation of heart muscle with many possible causes and very variable clinical presentation. Majority of patients are asymptomatic, which means no troubles, or present with mild and transient symptoms, which may include chest discomfort and some cardiac arrhythmias. Increased incidence of myocarditis has been recently described also after mRNA vaccination against the COVID-19. It should be noticed, however, that such events are very rare and occur only 3 times per 100,000 of vaccinated persons. And even more importantly, if patient got infected by COVID-19, the incidence is more than 3 times greater, which means 11 events per 100,000 persons infected, as I showed in the figure.
Well, while studies are ongoing, actually there is no data that the COVID-19 vaccines may cause any female infertility. What we see is that sometimes menstrual disturbances are described, but only in the menstrual cycle in which the vaccination was administered. So no problem at the level of female infertility. With regards to the male, what about our men who are very concerned about their fertility? Well, they should certainly get the vaccination because actually there is no negative effect on sperm quality. But the COVID disease as such could have a negative impact on testicular function, on sperm production, and on male fertility. So some studies have even shown that the virus has been found in sperm of men with a COVID infection. So there it can have a negative impact on the male hormonal system necessary for normal sperm production. What you need to know is that although the overall risks are quite low, that people who are pregnant or recently pregnant, they are at an increased risk for severe illness. And as you can see in the graph, this severe illness is significantly increased in patients who got no vaccination. They might require hospitalization. They might even require the admission to the intensive care. And in some circumstances, it can also lead to death. So, ladies and gentlemen, I would certainly advise to perform the vaccination in women who are pregnant, who are breastfeeding, who are trying to get pregnant now or in the near future. People who are pregnant can receive also the booster shot.
If you have not been vaccinated and have not yet been infected, you should get vaccinated right now, immediately. If you were previously infected and have already recovered from the disease, but have not yet been vaccinated, you should get vaccinated as soon as possible. If you have been vaccinated with 2 doses of messenger RNA or vector vaccine, you should receive the 3rd dose of the preferably messenger RNA vaccine 4 to 6 months after the 2nd dose. And finally, if you were vaccinated with a single dose of Janssen or Johnson & Johnson vaccine, you should receive the 2nd dose or preferably messenger RNA vaccine now, immediately, and the 3rd dose after 6 months.
The effect of the COVID vaccination on performance would be no different to the vaccinations you've already had at school or in your team for other illnesses or to travel abroad. Many people will find no effect of the vaccination, but you shouldn't be surprised if you have some aching, tiredness, fever, and of course some soreness in the arm where you've had your injection just in the first 24 hours. If you want to take some paracetamol for that, you can do. You don't have to stop training unless you have a fever, but if you're planning when to have your vaccination, it's a good idea to think about the timing of it so that there's as little disturbance to your training and your fixtures as possible. Although you should always be aware of any unexpected symptoms, the vast majority of players will not experience anything more than that after vaccination. After those temporary effects of having the vaccination have gone, then we wouldn't expect you to have any further permanent effects to your performance at all.
Recent data, as you can see in the figure, show that vaccinated people have far less chance to catch the virus than those who are not vaccinated. And this difference is not only in the infection rate, but also in the chance to die. Those who did not receive the vaccine have 3 times more chance to die than those who are fully vaccinated.
I hope that finally you found this video useful and information helpful, because it has been done by the people who have dedicated their lives to the science and to the medicine. They really know what they are talking about. So let's hear them once again, their important message.
Protect
yourself.
Get your shot.
By protecting yourself,
You're protecting the others.